Now, the other point that I want to go to, and again, we're more than happy to take questions. I want to thank every single Victorian who's presented to get tested. I can confirm that we've now done 106,000 tests in the last week and a half. In fact, with ramping up over the first few days, it's pretty much in the last week that we've had 106,000 swabs taken. That is 18,200 extra tests yesterday. So across the board, Victorians, I'm so pleased and proud. We asked you to get tested and people have come forward to do that, and I encourage people to keep getting tested even if they have the mildest symptoms. Those tests and their results will give to all of us the options that we want in terms of changing rules, changing settings, being confident that there's not more of this virus out in the community than we perhaps think. That surveillance work, that checking, is really very, very important. The last thing I think any of us want to do is to ease off some of the restrictions that we're not pleased to have to. No one's pleased that we had to impose them. But the last thing we want to do is to ease off any of those restrictions without a sense of confidence that we are truly on top of this, and that our case numbers aren't just a function of low levels of testing, but they're in fact a function of a really big testing program. In fact, the biggest testing program that our state has ever seen. So it was an ambitious target, and to get there 3-4 days early is a great credit to Victorians. And again, I want to thank every single Victorian who's queued, who's been there and gone through the testing process. It is critical to giving us the options that we all want. I think 100% of us want to get to the other side of this, and we want to get there as fast as possible. These tests and the results that will come through in the coming days are a very important part of that. Please keep, if you have any symptoms at all, please go and get tested. Just because we've reached the 100,000 doesn't mean we should stop. The bigger the sample, the more data we have, the more evidence we have, then ultimately the more options we'll have as a state as we look to the rules, if you like, over the weeks and months to come. I can also confirm that we have 105 active cases. We have obviously an outbreak at a meatworks. That is 13 of those 14 cases that I just referenced in terms of today's additional cases. That's the nature of outbreaks. This is a very infectious disease. It spreads rapidly. It can get away from you very, very quickly. And that's why we've taken such a cautious approach. That's why we're very pleased to see some stability in these numbers over a period of time, but we're certainly not at 0 new cases. We still have a long way to go. This is with us for quite some time. We will do what is safe. We will do what is appropriate. And again, let me thank every single Victorian for following the rules, for staying at home, for getting tested, for playing your part in a set of numbers that so many parts of the world can't boast. They simply cannot point to these sorts of numbers. They have a very different experience, and it's one that is all too tragic, all too real, and they would swap with us in a heartbeat. Be in no doubt about that. There are parts of the world that let off restrictions very early, thought they'd beaten it, turned out they hadn't. They now have even stricter lockdowns in place than they ever had before they let their frustration get the better of them, perhaps, and changed their settings. Nobody is enjoying these settings. I understand that. Important work is rarely easy, and it is really important that we stay the course on this. Not just to do what we want to do, but do what is safe and do what is, in the long run, in the interest of every single Victorian family, every single Victorian business. The last thing I think business wants is the notion that they reopen quickly, only then to have to close again. That would make a very difficult situation, well, almost unbearable, as businesses burnt that cash that they had perhaps put away for the restart, only then to have to be closed again. All of these things are being weighed up by National Cabinet. All of these things are being weighed up by our public health team, by our Cabinet, by our government. And as you know, Monday the 11th of May will present us with an opportunity to, as we've said all along, to update you both on test results and on the rules that will apply certainly for May. And indeed, we may give you some indications of our thinking and of decisions out of National Cabinet beyond that. I'm more than happy to take any questions you have.
So the one other case, is that a hotel quarantine or unknown? You've said 13 of the 14.
I think we're still investigating the origins of that person.
Of those 13, how many actual workers at the meatworks? How many contacts?
Sure, I'm advised that there are 7 workers and 6 close contacts of those workers.
So you would expect to have further cases coming out of that cluster, given what you've said about the speed of...
Yeah, well, look, outbreaks, the nature of outbreaks are that you obviously, you go in, you contact trace as aggressively as you can, you follow up literally thousands of leads, every person that's been in close contact with anybody who's tested positive, all the different locations they've been to. It's a massive exercise. It's called coronavirus detective work for a reason. It's complex. Sometimes links that seem quite obvious are not links at all. You've got to follow all of that down. That's what the team of more than 1,000 coronavirus detectives do. But as good as their work, sometimes this will get away from you in a given workplace or a given household or a given setting. This is such an infectious disease, travels so rapidly. We certainly couldn't rule out that there would be more cases. But I just want to be really clear about this. I am very proud of the public health team in the response that they have provided to every positive case. And this outbreak, as serious as it is, was singled out by Brendan Murphy, not the Chief Health Officer of Victoria, the Chief Medical Officer of the Commonwealth, singled this out at National Cabinet earlier in the week as a model example of how to deal with an outbreak. The team are working so hard, they are doing everything possible, and they follow up every lead, and they do it diligently. And it's one of the reasons, not the only reason, but it's one of the reasons why we have numbers that are the envy of the world. If we'd not had that sort of public health response by a team of people who are passionate and committed and true professionals, some of the best contact tracers in the world, then we would not have these numbers. We would have had more and more outbreaks, more and more cases, and indeed more and more deaths.
Just on close contacts to the cases at Cedar Meads, is there a concern that they've spread to their family, the employees?
Well, obviously. Well, that's why you do contact tracing that involves anybody that a positive case or someone who's suspected of being a positive case. If they had symptoms, for instance, waiting for a test result, that's why you speak to their family. That's why you speak to friends and others that they may have spent time with, work colleagues. It's also why you don't spend the time of contact tracing experts making phone calls and searching at places where people have not been. You focus on where they have been. And that will be for some, they will have come in close contact with housemates, with workmates, with partners, with people that they share spaces with, whether that be in their home or in other settings. Everyone, listen, hang on a second. Everybody, I don't know that I've ever walked off this podium without answering every single question, much to the frustration of my staff. Everyone's question will be answered. So, Rachel.
A nurse and an aged care worker.
Yes.
Are you aware of any other cases in aged care or health facilities as a result of this cluster?
No, I'm not aware of any. If that changes, they will be more than happy to provide you with that info. Ultimately, people can have such mild symptoms. They can do the right thing. They can not go to work, or they can go and get health care that they need. And there was, of course, an industrial accident that led to a person, unbeknownst to them, who turned out to be positive, presenting to a hospital. That's, again, just makes the point. This is so, this spreads so rapidly. This is such an infectious and contagious thing that's why we have a team of more than 1,000 people. And look, that team may well have to grow when we move inevitably to a situation where some of the restrictions that we've put in place are eased. Because we will, if we're not, well, I won't say it's inevitable, but it is likely that if we loosen up some of the restrictions we have in place, we will see more and more outbreaks. And I'm very confident that the team, the public health team, which is a massive team of committed Victorians, they are among the best in the world at what they do, will continue to do that job in the interest of every single Victorian, their safety and the recovery from this global pandemic.